All right, welcome back YouTube. Today we have our renowned guest Dr. Viren Karya, who is MS Anatomy, and he has been my mentor since 2013. And I met him first of all in 2013, and since then he has been my constant guide, be it academics, be it work life, be it professional things, be it finance, everything you name it. I always had Dr. Karya on my back. So thank you so much for giving me a chance to host you with Dr. Viren. It's my absolute pleasure to host you.
Hi, Dr. Apurva. In fact, it's my pleasure to have a student like you.
Yes, so in this video, basically, we'll be talking about the most important thing is how to study anatomy, because whenever the student enters in first year of medical school, the only hype they have is about anatomy. They would just ignore physiology, biochemistry. They would just spend like their entire time in studying
Exactly.
about anatomy. So, Dr.
Exactly.
Viren, how would you summarize in a nutshell that how one should approach anatomy as they enter first year of medical school?
See, first of all, I would like to say that nothing like hype or one don't have to worry about clearing anatomy or it's very difficult or something like that, because even for India, National Medical Commission has also allotted more hours, almost double hours than physiology and biochemistry. So you will be getting, all the students will be getting enough time to study. Second thing is, the most important thing is NMC has incorporated, or rather every country has incorporated dissection. So whatever thing you are studying in your lectures or anywhere, that you are supposed to see, you are supposed to find in dissection. So everything will be taught to you twice, like in morning in theory, and same thing you will be
Right.
revising in dissection, same thing you will be revising in demonstration. So everything you will go through twice. So that, I think that should not be a hype or phobia kind of, that I need to clear the anatomy or it's very difficult or something like that. And that is what we are going to discuss, how we can make it easy, how we can go through it, and how it can be in the form of a smart work rather than hard work, rather than doing in continuously working without giving a second thought that I'm not getting into it, and just you are under tremendous stress before exam. So how to go through it, that we are going to discuss today in this video.
Right, absolutely. And like there is like certainly some difficulty with anatomy, like as far as we want to remember certain things. I still remember my first year of medical school. It's everything which we don't know. It's like abductor pollicis longus, abductor pollicis brevis. But
Yeah.
that is true that as the time progresses, we can, make some meaning out of it. But otherwise, median nerve, like ulnar nerve,
Yeah.
those are completely foreign things. So do
Yes.
you still think that it's something like more related to memorization, like rather
Yes.
than
See, see, for that, you are right. It's a Western thing, because entire modern medicine is derived from Western countries. So anyhow, we
right,
need
right,
to adjust with their names, because all the scientists, like always, I used to give example of, there is a foramen of Monroe, or there is a foramen of Lushka, or there is foramen of Megandy. So because
right,
they have invented or they have found out first, then we have to adjust with their names and with their terminologies given by them. And there is again, most of the terminologies are Latin, most of the terminologies are Greek. So even for an English medium student, they are not used to with these terminologies. So it takes some time to adjust with those terminologies. Like
right,
we
right,
are accustomed with the terminologies like injury, but once you enter into medical school, then you come to know that injury is termed as lesion, or
right,
like pyrexia for fever. So we are not used to with such terminologies, but when once you are used to with these terminologies, you will come to know that, oh, it's just a fever, but it was initially in my sessions, it was termed as pyrexia by the professor, so I
right.
could not get it. But gradually, time and again, once you revise all these things, you will able to know. Second thing is, all the terminologies have got some reason behind, like you just now said that abductor pollicis longus or something like that, or median nerve. So if you are curious enough to find out why these terminologies have been given the names, why these terminologies exist, it's just because, say for example, median nerve, why it is called as median nerve, just because it has its course in forearm, that is exactly in the center of the forearm. That
Nice.
is why it is termed as median. So once you learn
Wow.
what is median, that is in the center. So in the midline of the forearm is the course of the median nerve, and from that forearm it has been given nomenclature of median nerve, not right from the brachial plexus. Likewise, the radial nerve is along the lateral border of the forearm, and ulnar nerve is along the medial border of the forearm. So likewise, as per the relation with the forearm, these nerves have been given the name.
Right,
If
right.
you come to know, if you are curious enough to find out why this name is given to this particular thing, why it is so
Uh-huh.
called, why it exists, then only you will able to remember. It's not like just you have to cram.
Right.
I'm always telling my students, so far almost of my 20 years of teaching anatomy experience, I'm always telling that even if you are feeling that I have got a good memory and I'll cram everything, I'll remember everything straight away, it is not going to happen in medical. You also know that so many stuff to remember, and not only remembering, we need to integrate all these things what you have learned in anatomy, that you have to integrate in physiology, biochemistry, in pathology, in medicine, in surgery, in orthopedic. So all these things are integrated with each other. It's not like once you remember, once you clear the first year, once you clear the second year, you are out. You don't have to worry about your
Right.
previous subjects. It's not like first, second, third year. It's not like first year or second year or third year or something like that. Every day everything will be integrated, will be useful. It's not like if you are studying pathology you have to forget about histology or forget about physiology. If you are studying medicine, simultaneously you need to understand, you need to recall your pathology classes, you need to recall the physiology as well. So
Right,
like
right.
always I'm saying that medicine is what? Medicine is physiology plus pathology combined, or pharmacology combined. If you join these 2 3 subjects together, it will be very easy for you to understand the medicine. Likewise, if you incorporate pharmacology with anatomy, particularly surgical anatomy, you will able to understand surgery very clearly. Like if you haven't gone through peritoneum in your first MBBS, then it is going to become difficult understanding in laparotomy. In your first surgical clinic or in OT, if it's a surgery of laparotomy, the operating surgeon is definitely going to ask you about the layers of anterior abdominal wall. So
Right.
it's not like you have passed the anatomy and you are not going to repeat it again. Day to day, in day to day practices, everything is useful. So that is what I am always emphasizing, that it's a medical. It's not like you clear 11 standard and you have to forget in your 12 standard, or like it's not like social study class that you don't have to worry about in your entire life. Whatever you learn in medical, irrespective of anatomy, I'm saying any subject, it is going to be useful in any time, any in along with any patient. So it's not like you can skip certain topic and you will be spared, nothing like that. So for that, what you are supposed to do is, as I said, you need to be curious enough. I remember I used to tell you also in 2013,
Right,
9 years
right.
back, be curious enough, be always question why it is there.
Right,
So
right, right.
if you know that the optimum temperature of spermatogenesis is 3 to 4 degrees centigrade less than core body
Yes.
temperature, you will realize that the testes should be outside the human body. Okay, and
Right,
for
right.
that we need to have a spermatic cord to support it, to protect it, to have contents within, like pampiniform plexus, like testicular artery, and so as we need inguinal canal. Particularly
Right,
it's
right.
very important for males. Okay, so far as the contents of the spermatic cord are concerned, the most important is vas deferens, like testicular artery, pampiniform plexus or vein. Now that is the usefulness of knowing why there is existence of inguinal canal, because of the testes. Like this is just an example, but likewise you can correlate so many things, and then you will able to know that yes, there must be inguinal canal, there must be some passage from human body to the outside for the testes to work optimally, in case of males particularly. So likewise, so many things you can correlate. Second thing is you can correlate with the first year subjects as well, like physiology and biochemistry. And so that recently the new curriculum has been implemented, like CBME, curriculum based medical education, CBME. In that we are also being emphasized to prepare a timetable of first MBBS in such a way that the thing should be in an integrated way. Like and in a particular month, if we are teaching the students thorax, like heart and lungs, so physiology people should also come to teach cardiovascular system and respiratory system during that month only. Likewise, if we can integrate with biochemistry, people, like whenever we are teaching abdomen and liver particularly, and if that time if they are teaching some metabolism or something like that, liver function test or something like that, so that will be beneficial for student to integrate all these things parallel within that particular week. That yes, we have studied heart in anatomy in this week, and now we are going through cardiac cycle. So that will be very useful for that. So NMC is also emphasizing to integrate all these things together. And likewise, students, they have to do it by their own. Like if they are reading heart, then simultaneously during learning heart, anatomy of heart, they will have to go through how it functions, what are the heart sounds, what are the phases of cardiac cycle, something like that. So if they learn the subjects like this, if they integrate all these things by their own, then it will be, I think, easier for them to understand and register and remember for a longer period of time.
Right, right. That was a great explanation, Dr. Viren. And I still remember like my first year of medical school when you said like, okay, how would you differentiate erysipelas from cellulitis?
Yes.
And then you taught me about Millian's ear sign, that if it's involving the skin of the ear, that's erysipelas. And that question was there in my step 1, step 2, and
Wow.
step 3.
Wow.
So
So that is like, it's again nothing is useless whenever you are attending some lecture and you are saying that, oh, this will be again I'll have to learn in medicine or surgery, something like that. It's not useful at present in first year. It's not like that. Whatever thing you are learning anytime, nothing is useless. Everything will can come anytime. It can be asked anytime. So don't feel
absolutely.
this is a message for the students, that don't feel like if somebody is teaching you and that is not currently useful for you, but that doesn't mean it becomes useless. Anytime you can be asked, or anytime it can turn out to be helpful. So but the thing is, the concept should be clear, and for that you need to be curious enough that why there is absence of deep fascia on the face, or why there is
Right.
abundance of superficial fascia, or what is the significance of having these muscles in superficial fascia, or so what is the advantage of having rich blood supply on the face, and what is the disadvantage of having this rich blood supply on the face. So likewise, again, you need to associate certain things to remember. There is a common issue with all the students that it's very volatile. Anatomy is very volatile.
Yeah,
Even
yeah,
if we
yeah,
have
yeah.
read it in a week or 15 days back, we are not able to recall it. That is just because you are not associating the things with each other. If you can associate, supposedly, if you are learning histology of esophagus, okay, and somebody straight away asks you after 1 month of learning or reading esophagus, that somebody asks you what is the type of epithelium of esophagus, then you need to stress upon your mind and you have to recall that what exactly I have read and what was the type of epithelium for esophagus. Okay, but at the time of reading histology of esophagus or anatomy of esophagus, if you have read that what is the function of esophagus, it's just meant for passage of food. Okay, so there is nothing being absorbed, nothing being secreted, just it's a passage. This is, I'm giving an example how to remember, how to
Right,
associate the
right,
things.
right, right.
So if you have associated its function, that esophagus is just a passage of food bolus right from pharynx to the stomach, irrespective of pH, irrespective of the temperature, it has to allow this bolus to enter inside the stomach. Or if you are drinking something, any fluid, any liquid with any or any spice or any temperature, we are ingesting from pharynx to the stomach. So the sole purpose of having esophagus is it's a food passage. Okay, and
Right.
anything is just allowing something to pass through, it has to have continuous wear and tear. There is a
Mm-hmm.
road. Okay, if there is a road, cement road or asphalt road, okay, all the vehicles are passing through, so that particular road is continuously under wear and tear. And to cope up with this wear and tear, our human body has a provision of having stratified squamous epithelium. So if you
Absolutely.
know this function of esophagus, you are never going to forget about lining epithelium of esophagus. This is
Right,
always I'm emphasizing, understand the purpose of having that thing in our body,
right,
why
right.
it is there, why we have been provided this thing, what is the purpose of this thing. Then definitely you are going to understand the structural
Definitely.
aspect of that particular thing. So always put a why into that, always associate certain facts with that, and you will easily able to recall. That is what I am emphasizing.
Right, right.
Rest up to the students as per their capacity to grasp, because every student has got different capacity. So like me also,
True.
I have got memory of visual association. unless I put something in my vision along with the vision, it's a bit difficult for me to recall. So what I am doing is I am into watching some animations, or watching some videos, or looking at some images or 3D. Nowadays so many such softwares are available that is providing 3D images.
True,
Likewise,
true.
so many software, so many, or you can have, or all the students have got cadavers. So just go through it, see it, and there will be visual association of that particular thing.
True.
Once you have seen parotid in dissection, you are never going to forget about how is the shape of parotid gland. And once you have seen facial nerve passing to the parotid, you are never going to forget that facial nerve is passing to the parotid gland, and during surgery of parotid gland the facial nerve is likely to be injured. So it's very,
Right.
very easy to correlate the things once you have seen. So visual association is equally important. Now you, Apurva, you also know at this age, at this stage of your life, that how memory works. Just because first
Right.
MBBS students, they are very new to this medical science, they don't know about how our brain works, how the memory works. But there are various ways of remembering the things, and one I have told is association. Okay, so it can be in the form of visual association, it can be in the form of auditory association, like you have heard something in lecture and you can recall it. There is visual association in the form of watching the videos, or reading the book, or watching the animations. That is a second type of association. And third most important association is tactile association.
Right.
So you need to feel that thing. If you have felt a nerve in dissection, if you have felt an artery in dissection, if you have felt muscle in dissection, you are never going to forget that feel, and that will help you in recalling the things. So I'm always emphasizing that don't sit idle in dissection hall. Just use the resources given to it. It's very precious. I know so many students in my YouTube channel, they give comment that particularly in Middle East, they say, sir, we don't have cadavers. There is no provision of cadavers by college.
Oh
So we
my
cannot
God.
learn anatomy by dissection. There is no
Right.
provision. So they are relying upon the videos, they are relying upon the books, atlases, and all. So if there is a provision of cadaver, if there are plenty of cadaver available in your dissection hall, in your batch, and you are not utilizing, then it's your fault, not fault of anatomy.
Right.
So
Right.
use your tactile association, tactile memory, because just see if why the surgeon is skilled enough, because he is doing the surgery. By the time he has 10 years, 15 years of experience of surgery, just imagine how many times he has done that particular surgery. If there is a cardiothoracic surgeon, just imagine in his career how many times he has opened the chest wall, how many times he has done thoracotomy, and how many times he has done the cardiac surgery. So he is continuously into it, he is continuously having tactile association, and that is continuously improving his skills. So not only it will help you in recalling the things easily, it will help you in improving your skill as well. So
True.
first time, second time, third time you associate it, by the time fifth time, sixth time, you will become master of it.
True.
You will feel more confident about it, you will feel having more clarity about that particular topic. So use
Right.
your resources. If you don't have dissection, if you don't have provision of cadaver, then you can use simulations. There are virtual dissection tables available depending upon the facility given by your institute. You can use atlases, you can use certain 3D diagrams or softwares available. Virtually they are showing 3 dimension all the organs. Or if you have got bones, that is again very important tactile association. If you have felt that bone, if you have got a bone set or bones, and you are learning the bones with keeping the bones in your hand, that is definitely going to improve your
True.
registration of the
True.
anatomy. You cannot just remember anatomy by reading, forget about it, it's not possible. Even for most of the subjects of medicine, it's not like you can read, you just cram it and you think that I'll go through it. You can go through it, but in day-to-day practice it is going to become a nightmare for you.
Right. Right. Right.
So use all the resources possible, use all the ways of association of these things, and that will be useful for future.
Right. And we need teachers like you who can ignite the concepts actually. And I still remember, Dr. Viren, the day of like my Viva, where you asked, okay, do you like, have you ever thought about why do we have different kinds of epithelium as you move from top to the bottom of your respiratory tract? I still remember that. And like later on, when USMLE asked that, okay, whenever there is foreign particle which is stuck at the upper airway, it's cleared by cilia. When it is just down bottom, it's cleared by macrophage. So that was my ignition point where you asked me,
Yes.
said like, did you ever think about that? So we need more igniters actually, like you, and you
Because
you've already
see,
spent a
one has to understand that we as a human has got a fantastic arrangement of the tissues, extraordinary, very sophisticated things. So it's not like you can easily remember, you can easily understand. Just see how intelligent the doctors are. They are all scholars of their respective institutes, of their respective classes, their respective colleges. They are all toppers who get into medicine. Still they take 8 years, 10 years, 12 years to become specialist. Just
right.
imagine such intelligent, such cream of the society. If they are taking 10 years to become a specialized person, then just imagine how sophisticated our human body is. So
True.
don't take it lightly. Just go into it, just understand the mechanisms, understand. See, structure and function will work together. So if you go simultaneously both the things, structure and function, then it will be very interesting. Make it interesting, don't take a burden of it.
True.
That is in general my message to a student. Don't take it as a burden that you have to go through it, you have to pass, you have to get 50% mark, or you have to get this
Right.
many marks. It's not like that. It's not
Right.
like becoming a doctor is not enough. Okay, you have to deal with lives. Okay,
True.
not about piece of paper that you get a degree and you are done. It's not like that. Day to day with every patient, it's a viva. Every patient, it's a test in day to day life. If there is an OPD of 100 patient per day for a physician, then he has to check his knowledge 100 times a day, because all
Mhm.
the patients are of different variety, different sign and
True.
symptoms. So daily he has to appear for the test, and daily he has to clear that test. So
Mm-hmm.
don't afraid of the exams, don't afraid about the viva. It's a learning phase when you are a student, so you are learning continuously. See, our education system is like that. We are being afraid of appearing in exam, we are being afraid of clearing the exam. It's like mindset right from the school days that you
True.
cannot commit a mistake, you are not supposed to commit a mistake, you cannot fail. It's not like that in day to day
Right.
life. It's not like that. Even if there is a master of surgery, he can stuck in between a surgical
Definitely.
procedure, and he has
Yes.
to call his senior, he has to call somebody else to help.
Right.
It's quite possible, because once you open up a thing, once you open up a tumor, say for example, if an oncologist is there, or oncosurgeon is there, he himself is not aware of how much infiltration is there. So he
Right.
has to call upon, there is a team, there is always a team of surgeons or team of doctors. There is an associated, say for example, if somebody is a gynecologist, then there is a team working. Okay, there is associated pediatrician, there is associated anesthetist. So it's a team, it's not like a one person job. So in school what we are teaching that you cannot commit mistake, you have to be topper, you know everything. It's not like that in
Yeah,
medicine.
yeah, yeah.
Once you
True.
are into medicine, you have to forget about your grades of schools. Everybody is equal, everybody has to start from the scratch, and everybody has to work as a team. Don't hesitate to ask for the doubts. That is again very important thing. Students are shy enough, they don't come up with the doubts that what my colleagues will say, he is not knowing such silly things, and they will laugh, so they will bully me in future, or bully me in other classes. So I don't have to, I cannot afford to ask in between, or I cannot interrupt my faculty. It's not like that. So one has to come up, one has to break the barrier, and one has to come up with the queries, and that will again facilitate your learning. So
Right.
many things one has to, I mean, again, there are mentorship programs for all the colleges. I don't know how much it is implemented, but there are mentorship programs, and there are dedicated mentors to a group of
Right.
students, and they are dealing with these things. There is
Right.
always a language barrier. Many students are coming from local language, say Gujarati medium or Hindi medium, something like
Right.
that. So first is a language barrier for first MBBS, then there is a terminology barrier, then there is a barrier of hesitation, and everything is going so fast because it's just 1 year, 1.5 year.
Right.
So many things to learn. So it's again, I accept that it's a bit difficult, but it's not impossible. One has to
Right.
work hard, and one can easily go through it.
Right. I really like the way you said, like, there's a culture of idealism that you cannot make mistake. But
Yes.
right now at this point, I feel like thanks to those mistakes, man, like thanks that I did that
Yes,
mistake, and you learn
yes,
from those mistakes,
yes, yes.
as everybody makes mistakes. So
It's like for medical, it's a learning process. I remember one of my senior professor of surgery,
mhm.
even if he has got 20-25 years of experience of surgery, what he used to say that at present, till date, I am learning
Wow,
and I am reading Love and Bailey and I am getting something new out of it daily. Whenever
definitely.
I read Love and Bailey, I get to know something new. So
Wow,
it's so many things are given, so many things are there, and nobody can confidently say that I know everything. It's nothing
definitely,
like that in medical,
definitely
nothing like that. Everybody is in learning process.
true.
So one has to accept that it's a continuous process. Even if you are in practice, there are so many modalities coming nowadays. Okay,
Mhm.
previously so many medicines have been obsoleted. Now, so every 6 months, every 1 year, new skill, new things is coming, new medicines are coming. So one has to be updated continuously. Like even surgeons or very senior people are also continuously attending conferences, seminars, workshop. So many new technologies are coming. Like previously radiologists used to have hardly x-ray and something like that, ultrasonography or fluoroscopy, something like that.
Mhm.
Nowadays, see, so much of advancement has been happened in radiology, so they have to keep themselves updated. It's not like once they
True.
have gone through MD radiology and they are done. It's not like that.
Mhm.
They have to keep on updating themselves. So this applies to students as well.
Right, right, right,
So continuously, it's a learning process. Do not hesitate to learn. Do not
right.
just give up learning. Even if you are past first MBBS, it's not like you are master in first year students. It's like
Mhm.
you have to go through surgical anatomy again when you are going to see a surgery in your
Definitely.
surgery clinics. In your surgery clinics, even surgeons. One of my colleague who is oncologist, and if he has got commando operation or if he is operating for neck surgery, complicated neck surgery of any tumor of the neck, just imagine how complicated neck anatomy is. So in the morning he has to go through surgical anatomy very quickly. He has to go through overviewing the surgical anatomy of the neck till date, because he
Mhm.
cannot have any small nerves damage.
Definitely.
It's not acceptable. It's not
Right,
acceptable. So he has to be thorough with the theory, or he has to be thorough with the surgical anatomy even on the day of surgery. So
right,
it's
right.
not like second or third MBBS student, they are thinking that we have done first year students or first year subjects or second year subjects, and now we don't have to read all this again. It's not like that.
Right.
Anything anytime will come in front of you in the form of patient or in the form of, particularly in emergency, it's like if you are attending casualty or if you are attending ICU, and anytime any patient can go into complication or anything can happen to a patient. So you have to be on toe, you have to be very alert. And
Yeah.
you
And one
can
quick
easily.
example is like somebody is having pneumothorax, like where would you insert? Like in on the
Yes,
upper border of the rib or the lower
yes,
border? Because
yes.
you might injure the intercostal nerves and
No.
vessels.
So that particular thing will be recalled quickly if you have seen intercostal nerve in dissection, if you have got
Right.
visual association of that memory, or if you have felt that if you have dissected it by your own, you would be having very long lasting associated memories, and
Wow.
that will make you confident enough to insert that ICD. Okay, to do ICD. So that is the important thing, to use maximum possible, maximum available resources in your institute. Okay, one
Right.
more thing is students are particularly, I don't this may look funny enough, I don't know, but I have to emphasize on this thing that I don't know about the foreign graduates or foreign medical graduate, but so far as almost my 20 years of experience, and recently what I am experiencing is students are saving their money in buying resource material. you
Right.
know
It's very
like
important.
an application is available, or any resource material, any subscription is available, any video is available, like any reference book is available. Reference books are your investments.
Mm-hmm.
Have you ever visited a lawyer? Have you seen his office? His office in backside, he has got cupboards and cupboards of racks and racks of all the law books,
Mm-hmm.
all the books of law, different kinds of law. So likewise for a medico, you have to have all your reference books. It's a kind of investment.
Definitely.
No,
Be it
you
physical or digital, like in any
yes,
form.
in any form, one has to have these things, because these are the things which will help you in any emergency or any time. If you are not confident enough what exactly it is, then you can anytime refer it. So it's not like in first mbbs, I cannot afford to buy Gray's Anatomy, because it's just a small first year, 1 year of anatomy, and I'll go through it and I don't have to read anatomy again. It's not like that. See,
Yeah,
reference books are useful throughout your life. It's a kind of
definitely.
investment. Don't make a mentality of saving money in buying resources.
Yeah,
You reduce your pocket money. You reduce your expenditure in some silly things like buying a costly mobile, or buying a data pack, or students are using these monies. It's not like they are deprived of. They are using their money in watching movies, spending 500 rupees, 1000 rupees in weekend by partying and all. So see, I'm not saying for all, but most of the students, this is a scenario. They spend in eating outside, or they are spending like that. They are just throwing away their money. But
definitely.
whenever it comes to buy a book, a reference book, or anything which is going to help them in their career, then they become conservative, that oh,
Yeah,
let me find out some torrent, or let me find
yeah,
in Telegram, or let me have some first copy of this and something like that. It's not like that. It's a kind of investment. Okay.
definitely. And whatever you
So
invest is like you have paid something for that, you will value that. If you get
yes,
something for free, there's no value of it.
no value. And another thing is, in free you may not get a complete thing. Okay,
Right.
they might have given partially, something is free and they have been circulating, and you are getting it, but it's not like a complete covering entire topic or
True,
entire
true,
subject.
true, true.
So please do not hesitate in buying a book or subscription or something like that, because it has a value. Yes, you said that, because somebody has prepared, somebody has given a lot of effort in preparing these things. It's not like just they have come out with something which is useless, and they have come out to sell something in society. It's not like that. Resources should be bought, resources should be kept throughout, okay, be it in any form, and they can turn out to be very useful anytime in your life.